My name is Gilda Tachedjian and I am the Program Organising Convenor for the 2014 Australian Health and Medical Research Congress, which will be held from the 16th to the 19th of November at the Melbourne Convention and Exhibition Centre. The purpose of this presentation is to outline AHMRC's vision for the 2014 Congress, which builds on our previous successful program by expanding to highlight transdisciplinary research, which represents the future in effectively achieving translational outcomes in health and medical research. In this presentation, I will cover the original concept and structure of the Australian Health and Medical Research Congress, the rationale for why we are embracing the transdisciplinary research paradigm for the 2014 Congress. I will discuss the meaning of transdisciplinary research, since this term is often confused with multidisciplinary and interdisciplinary research, and I will also provide specific examples. I will highlight the type of disciplines and associated organisations that we would like to attract to the Congress. I will outline how we plan to incorporate transdisciplinary research into the Australian Health and Medical Research Congress program, and I will end by providing reasons why you should consider attending the Congress in 2014. The Australian Health and Medical Research Congress was the brainchild of Professor Steve Wesseling during his AHMR presidency in 1998 and was modelled on the Federation of American Societies for Experimental Biology, or FASEB meetings, to bring together scientists from different research areas to promote multidisciplinary exchanges and cross-fertilisation between disciplines. The inaugural Congress, organised by Professor Bronwyn Kingwell, was held in Melbourne in 2002 and was an overwhelming success with the participation of 25 societies and over 2,000 delegates. The Congress is now established as a major biennial meeting on the Australian conference calendar, with 5 meetings being held since 2002 in major capital cities, Sydney, Melbourne and Adelaide, with a meeting returning to Melbourne in 2014. The format of the Australian Health and Medical Research Congress over the past 10 years has included organisations holding their full annual meetings, including the AHMR holding its National Scientific Conference. We also have symposium partner organisations holding their joint symposia or workshops. We aim to integrate the meeting by promoting cross-cutting themes across society-specific programs. One of the highlights of the meeting is the 3 to 4 inspirational invited plenary speakers with broad appeal normally selected by consensus from all participating societies. We have additional international and national speakers invited by participating organisations, free communication and poster sessions, which are an integral part of past and future meetings, in addition to awards for best presentations from students and early career researchers. And also incorporated in the program is an NHMRC symposium and a public forum on topical issues in health and medical research. Our vision for the 2014 Congress builds on the successful Australian Health and Medical Research Congress concept, where we aim to set the agenda for how best to maximise investment in medical research towards translation into policy and practice. This is motivated by the expectation from stakeholders, including the general public and politicians, to achieve better health through research, which is underscored by recommendations of the McKeon Review, which includes embedding research in the health system by forming integrated health research centres, and the Research Translational Faculty Initiative of the NHMRC to identify gaps between research evidence and health policy and practice in major health issues, including cardiovascular disease, obesity, dementia, and diabetes, just to name a few. We believe transdisciplinary research represents a framework to most effectively solve complex diseases and translate research discovery into practice, which will be highlighted at the 2014 Australian Health and Medical Research Congress. While there is an emphasis on translational research, we are cognizant of the fact that basic research is an integral part of the Congress program, and that the continued support of fundamental research is critical for not only advancing knowledge in medical research, but also sustaining the translational pipeline. So what is transdisciplinary research? Well, it's team science, where researchers from distinct disciplines contribute their expertise towards a common scientific goal to understand and solve complex problems. This is in contrast to multidisciplinary research, where researchers have distinct goals. In other words, researchers from a variety of disciplines work together at some point during a project, but have separate questions, separate conclusions, and normally disseminate in different journals. Interdisciplinary research, on the other hand, is where researchers can inform each other's work. In this case, researchers interact with the goal of transferring knowledge from one discipline to another. So transdisciplinary research incorporates, if you like, elements of multidisciplinary and interdisciplinary research, but the major difference is that everyone is working towards a common scientific goal or translational outcome. To elaborate further, transdisciplinary research represents a common conceptual framework among members to address a specific question, as indicated in the previous slide. Collaboration is not only between researchers from different disciplines, but also between researchers and non-academic groups with a stake in the problem. It is an action-oriented approach that leads to socially useful, feasible, practical, and will lead to effective and sustainable solutions. It represents a constant flow between knowledge and practical application, for example, from bench to bedside and then back again. And the overall goal is to provide a link between research knowledge and the decision-making processes by engaging stakeholders with a stake in the research results, such as patients and policymakers. An example of the transdisciplinary research approach is highlighted by the work of the 2013 AHMRC medalist, Dr. Anna Wirtz-Justice, where her fundamental research findings in chronobiology, or biological rhythms, has been merged with the distinct disciplines of neurobiology and psychiatry to be translated into light and wake therapies as adjuncts to drug treatment for depression. In addition, combined with architecture, her research has led to the incorporation of novel lighting strategies in architecture to improve sleep, mood, and cognition in Alzheimer's patients. A second example of transdisciplinary research comes from the Harvard Transdisciplinary Research in Energetics and Cancer Center, where the overall goal is to investigate the relationship between obesity and cancer and to translate these findings into actionable behavioural interventions to reduce the risk of obesity and cancer. As you can see in the flowchart, this transdisciplinary research approach integrates fundamental research with the impact of social and built environment, genetics, physical activity, obesity and sleep patterns to understand how to reduce cancer risk and survival. The theme for the 2014 Australian Health Medical Research Congress is transdisciplinary approaches to chronic diseases. And as you can see on this slide, the theme incorporates many different complex health problems, from cancer and obesity to cardiovascular disease, autoimmune diseases and mental illness, just to name a few. The examples I have given of transdisciplinary research show that it can merge disciplines not immediately recognised as being involved in medical research, such as architecture and environmental science. For the 2014 Australian Health and Medical Research Congress, one of our major goals is to not only welcome back societies and organisations who have supported and participated in our Congress in the past, but also encourage the participation of new societies representing diverse disciplines to join the transdisciplinary team. Our strategies for incorporating transdisciplinary research in the 2014 Congress program is to invite plenary speakers who are leaders in the transdisciplinary space. AHMRC's National Scientific Conference will lead the charge showcasing transdisciplinary research. We will encourage participating societies to embrace the concept in this symposium if they wish to do so. And as mentioned previously, we will expand participation to include additional societies and groups involved in other disciplines. A forum to include key funders of health and medical research will be included to discuss funding models for transdisciplinary research and translation of health and medical research into policy and practice. There are many reasons why you should attend the 2014 Australian Health and Medical Research Congress. It will give you an opportunity to present your research to a broader audience. You will learn about transdisciplinary research and make connections to join a transdisciplinary team to give you that competitive edge. For example, if you're a basic researcher, you might want to expand your research portfolio to include working with researchers from other disciplines towards a common scientific goal or translational outcome. And finally, attending the Congress will enable you to learn how to tap into transdisciplinary funding models. We encourage you to join the Transdisciplinary Research Science team by participating in the 2014 Australian Health and Medical Research Congress as a delegate, participating society or organisation. If you would like to find out more about how you can be part of the transdisciplinary team, please contact Congress convenor Tina Bianco-Miotto, myself, or Catherine West at ASMR. We look forward to seeing you at the Congress in 2014.